1 in 5 adults in the U.S. had a mental health condition such as depression, anxiety, or schizophrenia. Yet, in 2020, less than half of adults and youth with mental health conditions and less than 10% with substance use disorders got treatment over the course of the year. Poor access to treatment is largely driven by a shortage of behavioral health providers, especially in rural areas, affordability of treatment, and stigma around people with mental health conditions. Louisiana faces these same issues with siloed and fragmented care. This lack of a coordinated behavioral health system creates barriers for individuals who need care. Those who are impacted the most are people who have mental health or substance use disorders, who are on Medicaid, who live in rural areas, and who are uninsured or underinsured. Currently, no single entity or individual is tasked with improving Louisiana's behavioral health system. Taslim Van Hattem is the Chief Program Officer at the Louisiana Public Health Institute.
Expecting clinicians to both see a client, provide adequate care, advocate at the legislature, fight for reimbursement, and mentor folks through their licensure while then trying to get their health system to provide strong telehealth services is expecting, in some sense, failure.
In most states, behavioral health state associations serve as a coordinating body for providers, organizations, and consumers to advocate for a robust, fully resourced behavioral health system. So, starting in 2020, Louisiana Public Health Institute, or LPHI, set out to explore the feasibility and interest for a behavioral health state association with grant funding from the Delta Center for a Thriving Safety Net. Shalina Davis is the Chief Executive Officer of LPHI.
The world has changed. Post Katrina, people weren't naming mental health or addictions as as something to pay attention to. But when we see this pandemic that happened with COVID, that was the first thing that was named.
LPHI learned from other state leaders about successful strategies to improve behavioral health and engaged with nonprofits and clinical organizations across the state. They heard a desire for collective advocacy, and providers told them, yes, we need a voice. Hearing this, LPHI focused first on building trust and listening to their stakeholders' needs.
That to me feels like being incredibly patient and empathetic while also balancing that with being action-oriented and understanding that you represent the sort of hopes and dreams of many who are doing really challenging work in very under-resourced settings.
Next, LPHI plans to co-create a vision for a behavioral health state association with consumers, providers, legislators, and government, based on 40-plus examples from across the country. To spearhead this initiative, LPHI would need financial support.
But it takes commitment towards funding the initiation and the building of a behavioral health association to ensure that we have financial sustainability to bring individuals together, to think about early stage development, to work in collaboration with national partners, to develop both the internal core infrastructure of what it means to build a sound, strong organization.
In the meantime, LPHI will continue to address gaps in the behavioral health system and push for a different future where people, providers, and organizations have a clear voice.
I think what excites me most is probably finally having a system that works for the people. I feel like if this works well, this would be, I think, would help foster a system that truly works for the people.
There's the need for understanding of behavioral health as an issue that impacts everyone and ensure that we aren't excluding any Louisianan from being engaged in high quality, accessible care.
While their ongoing efforts are essential in driving change, additional partners and funding will amplify Louisiana's transformative progress.